stressed, frightened, chronic pain, depressed. These are the real faces of addiction. If someone you know is suffering, the worst thing you can do is nothing. What you can do is call Williamsburg Place now.
What we know here at the Williamsburg Place and the Farley Center is that addiction is no one's fault, that there really is no shame involved in finding yourself in trouble and in need of help. The philosophy here at the Williamsburg Place and the William J. Farley Center is that we know that addiction is a chronic progressive illness and left untreated is terminal. It is a disease that affects the body, the mind, and the spirit. It's not important that people want treatment. It's important that they get treatment. The people who need help don't seek help. So it really is up to you to help them find treatment. And the best time for someone to get help is in the early stages. It's then that the prognosis is at its best.
We have a proven system, it's successful, and we know that it works because we measure it.
Well, our medical and clinical teams, I think, are really one of the finest. They're made up of very accomplished and professional individuals who have so much passion for the work that we do.
I think it's very, very important work, and I take it very seriously.
The type of person that we help are high-functioning professionals who have found themselves in trouble behind drugs and alcohol. They find themselves to be depressed, anxious, suffering from stress, or maybe even chronic pain.
Not everybody develops addiction because they were looking to have a good time and party. Sometimes people develop addiction as a result of a medical or a psychiatric problem.
So people come in overwhelmed, confused, they've been given a variety of diagnoses, often they're conflicting. They may also be experiencing anxiety or insomnia. They don't know whether those symptoms are coming from a psychiatric condition or possibly from their addiction or alcoholism.
If addiction develops, what can end up happening is we lose the ability to adequately treat the underlying condition, and the medicines themselves now become part of the problem.
So many people come in feeling that they're unique, that they're so different that nobody would understand them.
They walk in very nervous because it is the unknown, and I try to relieve that anxiety. Well, I kind of talk about myself. An addict of 16 years in recovery, I let them know that. I know when I forget that, then I stop being effective. You know, I kind of can put myself in their shoes because I've been there and know exactly what they need. You know, and all they need is somebody to understand and make them feel more comfortable. You know, I always let them know this is a good place to be. The staff is wonderful. Their peers are wonderful. You know, they're not alone.
All the members of the team are very involved in all aspects of care, and I think that really makes us unique. From the beginning, in treatment teams, we meet daily, where one of the physicians are there and interact with many of the members of the treatment team.
Many of our patients come in with the diagnosis of a co-occurring disorder. It might be depression, bipolar disorder, attention deficit disorder, or post-traumatic stress disorder. And many of those patients are given those diagnoses by doctors before they come in. They potentially have those conditions, but they may also be suffering the effects of addictive substances that they're taking. It can get quite confusing because people who are taking addictive medications can appear to have psychiatric conditions. So sorting that out, clarifying that involves a comprehensive interview. Sometimes it involves psychological testing. We talk to the families where that's helpful, try to get a family history, observe people, spend time, get to know them. Because in the end, the only way you can sort out those issues is by getting to know people.
We do begin the treatment right away, treating the pain as well as the addiction, in particular for patients who are going to require medication to treat their withdrawal symptoms. We have a variety of treatment options available to us. Some of these include using safe, non-intoxicating medications to treat the pain, but also a much longer list of non-medication treatment modalities. We have a pain management group here. Patients will have yoga, relaxation, even further down the line to mechanical and physiologic approaches, things that might happen in physical therapy, acupuncture. Again, we keep adding another layer depending on how the patient responds and how much more help that they need.
And from there, the patients receive lots of hours of group therapy. Most of the therapy is actually surrounded on that model. The therapists are so accomplished. We really are lucky to have such experienced and highly accomplished therapists that they are able to create an environment that's safe enough to do some more, a little deeper work.
Through the process of the group therapy, they're able to relate to other people and recognize the commonality. Part of what we do is help people compare in to be able to recognize the similarities rather than comparing outside and saying, I'm different and it won't work for me, because the fundamental premise and purpose of the 12-step program is to have that sense of relatedness, to be able to ask for help, to realize that I can't do this alone and that I really need to be involved with other people and have the power from not only the group but from a higher power, a sense of working with others. Part of what we do is to support folks, and the group process is so powerful for that reason, because people can relate to one another and they can call each other on things that they can relate to. I know that I do it and I can see you doing it, so that makes me very effective in calling you on the defenses that you're using. And so that's a very, very powerful part of the program, is to be able to work with folks to let them know that it's okay, it's a safe place, and part of my role as a therapist is making it that safe place. But ultimately they have to decide that they want to be real, and we can support that. So it's the clinical team develops that relationship and makes that trusting environment that they can feel that they're going to put something out in group and that they're going to be safe to do that.
The relationship that our therapists can make with their patients, it really is quite strong. It's very important. And it does start here in treatment, and we have alumni meetings twice a year. We're creating an alumni board, which I'm very excited about, to help foster those relationships. And that relationship that the therapists build with the patients, I think, is a strong part of our strength here at the Williamsburg Place and the Farley Center.
Our patients experience dramatic improvement in their pain management as well as the quality of their life.
We know that our patients have reduced anxiety, reduced depression. We know that our patients sleep well at the time of discharge. We know that there are improvements in all of the psychiatric symptoms they're experiencing: anxiety, insomnia, depression. We know that because we measure it, and we have an opportunity to see exactly what happens to each person when they arrive and how they are when they leave. We have a proven system, it's successful, and we know that it works because we measure it.
We understand that when people come here to the Williamsburg Place, they come here to get well. They're not bad people trying to get good, they're sick people trying to get well. That's everybody's biggest barrier to treatment, is how do you access it? Well, you just have to call us and we'll walk you through, the nightmare. The nightmare's over. Just call Williamsburg Place.
A comprehensive approach to recovery, healing mind, body, and spirit. Come here to get well. Williamsburg Place and the William J. Farley Center, a history of recovery.